and welcome to our first monthly chat with world-renowned specialists about different intriguing topics of behavioral medicine. My name is Alja Mazzini, and I'm a veterinary behaviorist currently working on my PhD at the Veterinary University in Bern. As our first specialist, I would like to welcome Professor Dr. Gonçalo da Graça Pereira. He's European specialist in behavioral medicine, a diplomat in animal welfare science, ethic, and law. Among others, he is also a professor of animal behavior training and animal welfare, and also president of the European College of Animal Welfare and Behavioral Medicine, and vice president of the European Society of Veterinary Clinical Ethology. We are starting with the topic that affects more and more dogs, their owners, and consequently also veterinary professionals. For different reasons, from better owner awareness of dog needs, better veterinary care, with more and more treatment options, dogs' life expectancy is greater than ever. And with that also comes some age-related conditions like canine cognitive dysfunction syndrome, which will be our today's topic. Dr. Gonçalo, maybe let's start with what exactly are we describing with this term? What kind of changes are owners expected to notice, and what kind of complaints are presented at their vets?
So thank you very much, Alja, for your kind introduction. So I would like you to ask me only by Gonçalo, if you don't mind, okay?
Perfect,
so let's keep the titles away. Otherwise, we are speaking between colleagues and friends. So it's a great honor to be here and launching this new monthly interview. Thanks also to preparing this interview, Alja. So it will be very nice to have this chatting tonight. So, in fact, as you said, this is a kind of problem that is increasing more and more in our society, because our companion animals, and not only dogs, they are living more. And as they are living more, they are having aging problems, exactly as you said, which means that many times, and this is related because the longevity has increased, which means that the number of dogs and cats as well presenting to consultation should be higher than we are seeing. In fact, this happens because many times this pathology exists so long ago that the owner has already got used to it, okay? There is also a belief that behaviors presented in this age cannot be modified. So people tend to not to speak about these problems. So in fact, the problem exists, but as it is considered a problem of age, people believe that there are no treatments, and besides all, the owners usually, they do not have enough information about this problem, which means that it's mandatory to do a very important anamnesis and making the correct questions to the owners, okay? But going to what you've asked me, which is what is happening in this disease, we see several changes on the brain, okay? And those changes are going to bring behavioral changes, okay? So brain is changing. There is a decrease of the frontal volume and increase of the ventricular size. The meninges have a higher thickness, and there are evidences of calcification. And obviously, there is already a desmyelinization with loss of neurons and neuronal connections. Okay, and together with other important changes, one of the most important is the changes at the hippocampus level, and these together with the brain hypoxia, all the damage of the vascular endothelium, all the vasoconstriction, it will finish with all the signs that we need to pay attention.
Thank you. Maybe I would maybe go into two different things that you mentioned. And first, maybe let's go at what you mentioned at the beginning. Yes, people either they don't notice because it's happening gradually. So they are just getting, oh, my dog is getting older.
Indeed.
And they just say, oh, this is old age. But maybe as veterinaries, here we have a role that we play, and that when we see an older dog, at least when they come for vaccinations, we should ask some questions. What is the things they should ask? What should they suggest to the owners? What is our role to do in these cases with older dogs? And when is the age when we should start asking these questions?
Okay, let's go first to the question of age, and in fact the age depends on the breed. Okay, so if we're speaking of a Great Dane, for instance, we are speaking around 5 years. If we're speaking about a smaller breed, then we are speaking about 7, 8 years old. In some cases, even 9 years old. Okay, but generally saying, we could consider around 7 years, an average. Okay. Instead of speaking directly and mentioning what should be the questions, I'm going to mention what are the guides that I usually give for people, for colleagues to follow and to make the proper questions. And usually we speak about the DISHA, which is DISHA and another A, where D is disorientation. There is a confusion because there are changes in some specific brain level on the spatial orientation, and the animal get lost many times even in his own house. Okay, then I, from interaction, there are changes in the interaction of the animal. There are situations where the animal become more dependent. Remember that those animals, they are also losing their sight, their hearing, so they are becoming more dependent. But there are other situations where the dogs or even the cats, they become more isolated. And for instance, in cats, usually this happens a lot because they are feeling pain and other situations, and they prefer to get away from other stimuli, including the human interaction. Then as from sleep, there are changes in the sleeping cycle. There are animals that are awake during all night, which disturbs a lot the owners, and sometimes this is the only reason that make the owners come to the consultation, because they are not sleeping. Then we have the age from house soiling. Animals that learned previously, they start to urinate or defecate inside the house, which is a sign of behavioral changes. Or there can be other situations where we have polyuria and incontinence. So we need to always make a differential diagnosis. Then we have double A's, A from activity and A from anxiety. So in terms of activity, usually there is a decrease on the activity. The animal is grooming less. Sometimes they have less interest in food. They are exploring less. Once again, the social interaction and play decrease as well. So in terms of anxiety, there are many signs of anxiety in those animals, because as I already mentioned, they start losing their sight, their hearing, they got lost, and they start suffering. They start feeling very anxious. Okay, so I think that with the signs, Alja, we already can organize our questionnaire and all the questions that we want to make. Yeah.
Yes, I agree. And but I think the big problem that owners and vets have is how to say, is the consequence of canine cognitive dysfunction syndrome, or this is something, you know, pain related or something else, or he's just losing sight, or he's losing vision and hearing and so on. So let's say the owners comes to us with some of those complaints. What's the first step that we as vets can do?
The first step is always rule out other diseases, okay? However, having other diseases doesn't mean that the animal don't have dementia or don't have aging process, okay? So the animal can have chronic kidney disease and aging process. So the animal can have two diseases at the same time. And this is very important to remember. Obviously that if we want, most of the times, if we speak, for instance, of Alzheimer's disease, which dogs are the model for studies of Alzheimer's disease, because of the similarities between the brain aging of dogs and brain aging of humans. In fact, what happens in this situation is that if we want to have a final diagnosis, usually this is made post-mortem. However, there are situations that we can see the changes that I've mentioned in an MRI or in a CT. So there are changes which are neurological that can be seen in imaging. Okay.
Yes, I agree, but here I think it's always, or in a lot of cases, is the problem of MRI, CT, that owners of all dogs don't want to put dogs in anesthesia and so on. So is there something that owners can do to monitor the progress of the signs, or they start noticing something, and what can maybe the vet suggest the owners to do and to see the progress of these signs?
There are some laboratories that are selling some supplements for aging processes, and they have a questionnaire. And there are questionnaires available that we can have in our waiting room where the owners can fill it in. It's very easy, and then you can put it in your files. And then on the following time, the owners fill it in again, and then you have two ways to compare. And this is quite easy. It's the owners can have it in a Google form, and you can send it to your owners at home. They fill it in, and they can compare every 6 months, every year. So this is a good way to control, because in fact, unfortunately, we don't have the youth the youth water. We haven't found a miracle. So what we're going to do is to delay the aging. We are not going to stop the aging process. We are going to delay it and to put it slower.
Yes, thank you. And I think this is really a good idea, because it's not invasive. It's something that every owner can do at home, feel safe about it, and interested. And then I think it's easier for us as owners and vets to see this progress. So yes, definitely. It was happening occasionally, but 6 months later is happening 5 times a week. And I think this is a nice progress to see in animals. So yeah, I think that's always good.
And Alja, having these questionnaires available, for instance, in the waiting room, it allow us to make less questions, because otherwise we are always in a rush. We want to I know that in all our faculties we were prepared to do a quick consultation and focus on the physical signs. And in these situations, when we're speaking about behavior, we are not speaking about physical signs. We are speaking about other signs that we need to ask the owners. And if we have the questionnaire, it makes our life easier.
Yes, I really agree. I totally agree. It's easier because vets are really, some have 15 minutes to do the whole consultation, some maybe more, but in 15 minutes it's hard to assess everything that we need to see in an older animal.
In fact.
Okay, let's continue in the sense of the dog or the older animal is there. We ruled out some pain, and we see really just behavior problems, and we say, okay, I think that at least as a differential diagnosis we have CCD. So what now? What are there any treatments, supplements? What can we do? Or is this a terminal diagnosis now, or we can still do something to prolong and to make the life of our animal more happier and longer?
Yeah. So Alia, as I said, the cognitive dysfunction syndrome doesn't have a cure. It's a progressive and irreversible process. However, when we speak about treatment, we are speaking about a goal, which is minimizing the clinical signs and delay the progression of the cognitive losses. And usually we are speaking about 4 different approaches. Which are the first are brain stimulation, pharmacotherapy, nutritional and diet treatments, and supplementary treatments. Okay. Shall I speak a bit of each of them?
Yeah, I would really, yeah, that would be great. Maybe we don't need to go into really detail, but just what can vets do and what can they suggest? Yes,
that's
perfect.
great.
Thank
That's
you.
Great. Sounds great. So in terms of brain stimulation, there are easy exercises that can be done. You have lots, you can find on the market lots of cognitive toys that you can use, always paying attention to not causing frustration to the dogs or the cats. Okay, very important. So always start by something easy and then increase the difficulties. Training the dog, training the cat, this is part of the brain stimulation.
Yes.
And remember that many times those animals, they forget what they learned previously. So it starts working using always positive reinforcement. And this is really very important to use the adequate techniques of training, because this is mandatory. Otherwise, you will be breaking the bond with the animal. Then I'm
sorry, I would maybe just add, sorry to interrupt you, just what you said, exactly what you said, that maybe they are forgetting, but it's not our goal that they learn new tricks or new stuff, but just that they practice and that we interact with them. So even if they forget the next day, it's not the goal, not that the owners get frustrated, it's just that we do something and that they practice. So it doesn't matter if they forget in half an hour, just that we do something.
Exactly. Yeah. And that's part of the brain stimulation. Yes. Is like the games that we have for humans, like the Sudoku and others, which is brain, it's stimulating, nothing more than this. So yeah, I totally agree with you. And obviously that when we're speaking about motivation, we need to have the motivation high. So we need to have clear signs, clear reinforcers. We need to be consistent more than ever, despite this is a general rule for all stages of the animal's life, but here more than ever. Okay. Yes. And as the animals are losing their sight as well, I usually use and exaggerate in hand signals as well. In terms of environment modification, as the animals, they got lost many times, even in the household. Sometimes there are this kind of stimulation that can be useful on the animal's perspective, which is in each room of the house there is a different smell, because the smell is the last scent that the animal is going to lose. So at least now I feel this smell, I know where I am, okay? And this can be very useful for the animal. However, careful with the scents that you are using, because this can be disturbing for the dog as well. In terms of physical exercise, it needs to be adapted to the animal age as well. So we cannot ask the animal to go and make jogging every single day. Okay, so we need to adapt the exercise as well.
Yeah.
Then quizzes can be used, different games, and the owners can even create the games. And sometimes putting the owners to work is also very interesting in their perspective. Then the second step, the second approach is the pharmacotherapy. And generally there are two drugs that I like to use. One is the nisergoline and or propentophyline. And the second family is silegiline, okay? Usually nisergoline and propentophyline, they are vasodilators, and what they will do is increasing the blood flux to the brain, specifically in the ischemic areas, and consequently they will increase the oxygen and the glucose income. Okay, when we're speaking about silegiline, silegiline is a selective inhibitor of monoamino oxidase, and they regulate the dopaminergic and noradrenergic functions. And the first action, which is in inhibiting the monoamino oxidases, is very, very good for the senior animals, where the MAO, this enzyme that I've mentioned, is increased. Okay, despite this, silegiline also protects from oxidative stress and toxic effects of free radicals, and this will be very, very well seen to protect the dopaminergic neurons and the selective action in the nigra striatum region. That's why this drug is also used for Parkinson's disease. So if you prescribe silegiline, inform the owners that for humans this is used for Parkinson's disease. Otherwise, the owner will arrive at home and will call you and ask, "Oh, my dog is with Parkinson's disease." So one step ahead, always. Okay.
Yes. Just in Europe, are they registered, those drugs for animals, or do we need to use the human version, or how does this work?
Depends on the country. Okay, so depends on the country. There are countries where silegiline is available for veterinary use, others that don't. In terms of nisergoline and propentophyline, I cannot say the names because it would not be fair for our friends and colleagues from the laboratories. But propentophyline is available generally in the majority of countries. I usually use propentophyline in mild to low signs of cognitive dysfunction. Okay, and I combine it many times with diet and nutritional treatment. Okay.
So yeah, that's the next question. What about the diet and supplements and so on?
So in terms of diet, supplementation with vitamin E and vitamin C is very, very important because it improves the antioxidants defenses and reduce the toxic effects of free radicals. And at the same time, vitamin E protects the hippocampus cells, which is very, very, very important in this area. There are also diets in the market. Once again, I'm not going to say the name of the brand, but that are enriched with coconut oil, sorry, which is a medium chain triglyceride, which increase the level of beta hydroxybutyrate, which is an alternative to one alternative source to of energy for aging neurons, and this is very, very interesting. We can also have diet supplementation with phosphatidylserine, omega-3 fatty acids, selenium, ginkgo biloba. However, when we're using ginkgo biloba, we need to be very careful because ginkgo biloba has a function of inhibiting the MAO as well, okay? And also resveratrol is very interesting because it protects the oxidative damage and reduce the amyloid substance.
So basically, owners shouldn't just give supplements, but discuss with their vets that not that it comes to interactions with other drugs that the dog probably is getting, maybe some pain medicaments or something for some other conditions. So
always discussing with the vet, because it's the only way, because especially on senior animals, where we have lots of concomitant diseases, in these situations is fundamental to discuss because of the interaction of drugs, side effects. It's fundamental.
Yes. What about, we see in older dogs also change a pattern of sleep, or maybe they are just wandering around in the night, which can be really stressful and frustrating for the owners, because I mean, it can take months or maybe years. And also we see some anxiety going on and fear, and what can we do in this sense?
Okay, silagilin is also managing the anxiety level as well. So if the animal is under silagilin should be given in the morning because of the dopaminergic effects. Sorry. But has also anxiolytic effect. Okay. However, if the animal is not requiring yet to use silagilin, but is not sleeping, then we can support the animal to have a normal sleeping cycle with, for instance, benzodiazepines. What we need to be careful is that we use benzodiazepines that are not metabolized on the liver, okay, because this senior pet's liver probably is not functioning already very, very well, okay. So I would go for lorazepam, oxazepam, because they are not metabolized on the liver. There are some colleagues using melatonin and aromatherapy. However, there are a lack of studies on these, okay. And then we have the nutraceutics as well. All the nutraceuticals, we are talking about L-tryptophan, casozepine, and many others that can be supplemented in the diet or apart the diet, okay? And these can be very useful. And finally, the pheromones. Pheromones are very, very useful, both for dogs and cats, and can be very useful to control the anxiety as well. Obviously that we are talking about combining, because there are no miracles. Silagilin all by itself will not work. Pheromones all by itself will not work. We are talking about a combined approach.
Yes. How often, now we have, let's say, our diagnose or our suspicion, we prescribed all that, we are guiding the owners. How often should we make regular checkups? Because normally what I suggested to my owners was, with older dogs, twice a year, that we do a blood check, that we, if possible, do an ultrasound of abdomen and so on. But now we have a therapy, and yes, some are also going through liver and kidneys. So how often should they come for a checkup?
I would say minimum, as you said, twice a year, minimum.
Okay.
Minimum. If the owners are available to do it every 4 months, then I would go for to every 4 months, which would be around 3 times per year.
Okay. And now, how would you say that? I think these things work all together quite nicely. And for how long can they, postpone the inevitably, or how long can we do that for? On your experience, is this, we are talking about weeks? Are we talking about months?
You mean after starting medication?
Exactly. After starting, we have a suspicion or a diagnosis. We are starting with medication. How does this look for the dogs?
So if the medication is working, then it's medication for life. Okay, so we will not stop it. It will be for life. However, for instance, if we start on silegiline, we should wait between 1 month and 2 months to start seeing results. Okay, this is not the type of disease that you take the pill and after 1 week you assess and the animal is better. Okay, so it takes longer, and if it's working, then it's for life.
Okay, thank you. Now the big and the hard question that comes at the end, if we are talking about cognitive dysfunction syndrome, when is the time that we should consider euthanasia or decide that we shouldn't prolong life anymore? When is this time? When should the vets have this discussion with owners? What are they seeing? Because I think what we are asked constantly, I would say, is, will I know when it's the right time? How should I know? And I think this is really hard for all involved.
Including ourselves. Okay?
Yes, including ourselves. Exactly.
I will return to these at the end. But something that bothers me a lot is quality of life. I am very worried with quality of life because after that, we are just one body, okay? We are not talking about quality of life or welfare after we are dead, okay? So before that, it's very important. And usually what I do, because this is a very difficult decision and needs to be done by the owners, we are there to support or not to support. But if the owners want our support, one thing that I usually recommend is a kind of a game. Okay, so I give the what I need to observe. Is the dog playing? Is the dog sleeping well? Is the dog eating well? So give several items to the owners. And then at the end, during, let's say, 1 week, at the end of each day, the owners will put 1 coin in one basket and 1 coin in another basket. And at the end of the week, they can count how many days the dog was okay and how many days the dog was not okay. And that way, it helps the owners to take the final decision, okay? And then we are there to support them.
Yes, I agree, because I think it changed. I think we have more means to help and to prolong life, but sometimes it's hard to decide when are we doing it for ourselves, or or when are we doing it for the animal. And I think the priority is the animal's quality of life and welfare.
Yeah, definitely. However, we have also responsibilities with our owners, and in fact, how many owners needs to take this difficult decision, and the only companion that they have is their animals. So it's very difficult to tackle these issue, and even for us, let's say that we followed these animals since he was puppy or kitten until this difficult moment, and it's time for us to support the owners, and if it is required, to cry with the owners. So we are not machines, and this is something from the past. Okay, so it's good to the owners to see that the vet is there for them as well. Okay, however, and we all know that we are in one of the professionals with higher risk of burnout, depression, and even suicide, and we need to take care of ourselves. We need to find ways to protect ourselves and to take care of ourselves, and also of the others that are around us.
Yes, our welfare also, not just the animals. I think the
Indeed.
welfare of all involved. Yes, I agree.
Definitely.
Yes. I think we mostly covered the whole topic, I would say. I mean, would you like to add something that you think that I forgot to ask or that we are missing? But I think we came from the suspicion to diagnosis to treatment and to end of life.
Yes, Alja, I totally agree. We covered the majority of the questions. You did a great work. Thank you very much.
Thank you for coming and for all your answers and discussions. I really enjoyed it. I think it's a lot of information for the owners and for the vets. And I think this is the topic that not just behaviorists, but the vets, practitioners can do so much.
Indeed,
and they are
definitely.
The ones seeing the animals. And I think with cognitive dysfunction, they don't come to us so often, but the practitioners are dealing with it. And I think it's an important topic to know what to do and to be more comfortable. And I think you were a big help in this to give them the confidence to work on that.
Thank you, Alja. And for those that have any other questions, everyone can reach me on the social media or through FECAVA. So I would be very, very happy to receive contacts from colleagues from all Europe or even from all the world. So thank you very much, Alja, and hope to see you all next month.
Yes, thank you. Thank you for coming and for answering all the questions.